Welcome back to DealBook. I'm Andrew Ross Sorkin. Thank you all for joining us again. We very much appreciate it, and we continue to hope to try to make this as interactive a day as possible. Let me just remind everybody that you can ask questions for Dr. Fauci in the comments right now, and we'll be getting to those questions as soon as possible. But right now, without further ado, please join me in welcoming Dr. Anthony Fauci, a man who needs no introduction this morning. Doctor, thank you so much for joining us.
Thank you very much, Andrew. I appreciate you having me on.
It's great to see you. There are so many questions and so little time, so let's just get right into it, because I think that there are so many things that people are trying to understand right now. And I want to start with this. The headlines feel so schizophrenic, in large part because we're hearing great news on the vaccine and the test results that have come back thus far. And yet on the other end of things, we're hearing news about spiking cases at levels that I don't think anybody ever imagined. And so the question I had for you is, when you think about where we're going to be, not over the next 2 or 3 months, because I know it's going to be terrible and you've said that, but when you think about where we are next fall after the vaccine, I know there was a point at which you had said, you know, you thought a vaccine would have 50 to 70% efficacy, but people would still be masking, people would still be social distancing. Now that we're hearing about these much better results, is it going to be that different? What is your family going to be doing next fall?
You know, a lot of that, Andrew, is going to really depend on the uptake of the vaccine, because whenever you talk about vaccines, there are two elements of it. One is the level of efficacy. In this case, of the group of vaccines that the United States government is involved in helping to develop or implementing the testing of through Operation Warp Speed, 2 of them right now have had striking results. I mean, more than 90% efficacy for one and 94.5% efficacy in another. That's a huge advance. I don't think you can have any doubt about that. But also very closely connected with that is how many people really take the vaccine. So we have a challenge ahead of some hesitancy about getting vaccinated that we need to outreach to the community to make sure that the overwhelming majority of the people in the country get vaccinated. Because if you have an effective vaccine and 50% of the people don't take it, you still have a considerable public health challenge, because the way you get an outbreak under control to bring it down to such a minimal level that's no longer a threat, you have to have a blanket of protection over the community with the vaccine that is the overwhelming majority of the community. So you're asking me what things are going to be like in the fall. I can tell you that really depends on whether or not we get the majority of the people, the overwhelming majority of the people vaccinated. The other point associated with that is that I think until you get to the point where domestically and globally, we no longer have a pandemic situation or an epidemic situation, but we have very good control that the level of infection in the community is so low, it's no longer a threat. Up until that time, you're not going to have a vaccine completely replace public health measures. There will always be an element of need to adhere to public health measures. The degree of stringency of it is going to depend upon the level of infection in the community. If we hopefully, and I'm aspirational about that, get enough people to be vaccinated that we no longer have a threat, as we get into the fall, we could be quite close to some degree of normality, certainly from the standpoint of the economy, of getting businesses open, of getting sports events being attended to. That is feasible, but it is within our grasp to do it. The science has already told us that a vaccine that's highly effective is now not only feasible, it's a reality. So now we've got to make sure we utilize that tool together with the public health measures to get everything under control.
What kind of rate of uptake do you think has to happen in a community for it to be meaningful? 70%, 80%, more? Yeah. What are we talking about?
I would think at least 75%, hopefully close to 80 to 85%. What I would love to see it like, let's get comparable about this. Look at measles. Measles vaccine is 98% effective. Not too different from 94.5% effective. everybody in the country, really, when you look at the recommendations and the implementation of measles, you get vaccinated, measles is essentially eliminated from the country. And you only see measles outbreak when people pull back from getting vaccinated, or we get people coming into the country where they have measles and bring it into a community. What I would like to see is the overwhelming majority of people get vaccinated so we could essentially really crush this outbreak.
So here's the question, and it is maybe perhaps the greatest behavioral science challenge of our time, which is how are we going to get the majority of the country to take this vaccine against the backdrop, by the way, of what has become a politicized vaccine and what's clearly been politicized related to masks and everything else, and the number of people who don't even believe that COVID is real.
Right. Well, I mean, obviously, to say that's going to be a simple task is avoiding reality. This is going to be a difficult task. We've got to do outreach. We've got to be transparent, and we've got to get public health issues out of the realm of political divisiveness. This is not a political issue. We've got to communicate that from above, from intermediate, and at the grassroots level. We're all in this together as a nation. If one element of the country or multiple elements of the country don't cooperate with an infectious disease, we are going to continue to be in trouble. We've got to do everything we possibly can to pull together as a nation and not as individual factions having differences that spill over into public health. Public health is something that has really nothing to do with politics. I mean, it's just a reality of what infectious diseases are.
I want to read you something. This is Congressman Margie Taylor Greene of Georgia on Twitter. She's a new congresswoman, and she writes, "Our first session of new member orientation covered COVID in Congress. Masks, 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 they said. I proudly told my freshman class that masks are oppressive. In Georgia, we work out, shop, go to restaurants, go to work and schools without masks. My body, my choice. Hashtag free your face." And I read that not happily, but I read that because I think it makes the challenge of what you're doing so much harder. And I wonder what you think, as you've tried to confront this challenge over these many months, what you think perhaps can even be done differently than what's being done thus far, because to some degree, I think we have to acknowledge that it's not working.
Yes, I mean, when you hear statements like that go against all of the scientific and public health data, it's really very disturbing. Andrew, I'm not going to have an easy answer for you about that. We have to have a consistency of message. One of the difficult aspects of this infection is that it's very unique in that so many people, a percentage of maybe 40%, get infected with no symptoms. Those who have symptoms are individuals, about 80% have moderate symptoms that they could handle at home. But there is a segment of our society, which is a significant group of vulnerable people, that when they get infected, they have a high degree of risk of getting into trouble. That's disproportionately represented in minority populations, but it's the elderly and those with underlying conditions. So it's a messaging problem because people see people who get infected and it has no problem. But yet we now have 245,000 deaths and 11 million infections. This is the worst outbreak that we've had of a respiratory-borne illness in 102 years. You can't run away from the data. It's incomprehensible to me how people are not seeing that. These are real numbers. And unfortunately, we've gotten into a situation of political divisiveness that a public health message like I'm trying to give is not encroaching on anybody's freedom. Public health message is your personal and your societal responsibility to your neighbors and to the rest of the country.
Doctor, a couple quick questions, because I know we don't have much time given our technical difficulties. Wanted to ask you about testing. Quest Diagnostics came out today and said that the return time to get tests is now actually going up, not down. And I wonder whether you think that the government at this point should still be meaningfully investing in testing. way beyond what we have today, knowing that there's a vaccine on the other end, because there's a question whether there's a private market or a public market for testing. Do you believe there should be an investment in testing, and do you believe we should be testing for years to come?
No, what we really need now, and we hopefully will get, but we don't have it yet, is a point of care testing that people can essentially do at home, like a pregnancy test, because the spread is community spread from people without symptoms. The idea of only testing people who have symptoms is not going to get to the bottom of the community spread from people who have no idea that they're infected. So what we would optimally like to have is that someone could wake up in the morning, take a test and know whether or not they're one of those asymptomatic people, and they should then not go to work or not go to school or whatever it is.
But do you think there should be massive surveillance testing? I think that the fundamental question is, should there be the use of massive surveillance testing on asymptomatic, symptomatic, just everybody around the country all the time? And should we as a country be investing that now, given that we know the vaccine is coming?
Yeah. I think surveillance testing for people who are not symptomatic, namely asymptomatic people, will be an important part of the control. We know that in colleges that have done that, where they've tested people before they get into the dorm or into the class, and then intermittently they do surveillance testing even of people who are without symptoms. Because when you do that, you identify someone who is infected and you temporarily get them out of the contact with the rest of the people. And that's how you can diminish the occurrence of outbreaks. That's a workable public health approach.
President-elect Biden said yesterday that the challenges that his team are facing, not being able to participate in a meaningful way as part of this transition with your teams and so many others that are working on this, is going to cost the country lives. Do you agree with that?
Well, yet again, you know what? We've got to be careful about that. There are certain things that we really do need to do together. Ultimately, that might cause lives, but you don't know. But right now, one of the things that is important, rather than my making a statement that will certainly be a soundbite, let me just get to the fundamental principle of it, that I have been now dealing with 6 administrations in my 35 years as director. I've been through 5 transitions. I can say that transitions are extremely important to the smooth continuity of whatever you're doing. Right now, we are in a very difficult public health situation. If you want to have good continuity, which will mean maximal attack on infections, hospitalizations, death, you want to have the continuity. I've used the metaphor, it's like passing a baton in a race. You don't want somebody to stop, give it to somebody, and then have them start running. You want everything to be smooth from one to the other. That's what we would like to do.
Have you gone to members of the White House or the Senate or Congress and said, look, we need to put this to the side, provisionally at least, let's work on it with the transition team. They can work out the election separately, do it in the most apolitical way. Have you had those conversations, and what is the reaction if you have?
I haven't had the opportunity to have that conversation, but I've made it very clear that I want to stay out of the political stuff that's going on. I'm speaking purely as a public health person, an apolitical public health person. We need to transition to the team that will be doing this similar to how we're doing it.
Why haven't you had the opportunity to have that conversation?
You don't just run in front of the Congress and say, I want to have a meeting with you. The Congress calls you before, they ask you questions, and I have always answered the questions quite clearly. So if someone wants to ask me that question, I will give them an honest and clear answer.
For President-elect Biden, is there one thing you tell him to do that's currently not being done?
Well, I would continue to say the things that I'm doing, that I'm saying right now. Again, whether people listen or not, that's up to them. I can only give advice. I think we need a uniform approach to this outbreak. We need some fundamental public health measures that everyone should be adhering to, not a disjointed, one state says one thing, the other state says another thing. States will need to do things differently because there are differences among the states, but there are certain fundamental core public health measures that we need to do now because we're all in this together. The thing we need to get people to understand is that when you're dealing with an infectious disease outbreak, the infectious disease, the virus in this case, doesn't know the difference between the border of Louisiana and Mississippi or North and South Carolina. It's a country that's involved. So we need to respond as a nation, not in a fragmented way.
Well, let me ask you a policy question. We have a number of business leaders that are joining us today. Do you believe that when the vaccine is available, that private enterprise should require employees, and perhaps public enterprise as well, to take the vaccine, and that people will have the equivalent of a vaccine card in the same way that you might get on an airplane to go to certain countries and show that you have taken a vaccine?
You know, I'm not going to give an opinion on that because I know that that will obviously be taken out of context in a way. In the United States, what I've learned is that when you try and force people to do something, they push back. If you do that in the current politically divisive situation we're in now, you're going to get pushback. What I would prefer to do is to reach out to the group and say, we have a 94.5% effective vaccine. Take a look at the data. We have 245,000 deaths and 11 million infections. You have a personal and a societal responsibility to protect yourself and those around you. We've got to get that message from every single person involved in it, and we got to keep hammering it home. I'm not going to change the divisiveness in this country right now, but I'm going to try as best as I can to get people to realize that we are all in this together. And the only way we're going to get out of it is that we got to get out of it together, not independently doing things in a haphazard way. That doesn't make any sense when you're dealing with a public health measure.
But that goes to the idea of having a national policy, and that's why I asked the question about what corporations should be doing about this and whether they should ultimately either have strict testing regimens or vaccination requirements, or whether public institutions should.
Well, I can tell you, though, that is something that should at least be considered. Let me give you an example. I'm a physician, and I take care of patients. In the NIH government hospital that I'm in, if I don't get a flu vaccine, I'm not going to be allowed to see the patients in there. So that is essentially mandating something. Whether industry wants to do that, I leave that up to them. Every time I get out of the public health arena and into the private or political arena, people start criticizing. I'm telling you, as a public health person, it would be to the advantage of the individual and to the nation if everybody gets vaccinated with a safe and effective vaccine. Now, if some people in industry want to make that a mandate, go ahead and do it.
Well, let me ask you a question in that similar vein around industry, and I don't know if you'll weigh in. I know you've talked about how you plan to celebrate Thanksgiving, which is to say not with other family members, and I know that you've recommended that others don't as well. If you look at airline bookings right now, they are going up across the country. Airlines across the country are increasing capacity. They're adding more planes, not just for Thanksgiving, but also for Christmas. As a public policy, from a health perspective, do you believe that is good policy?
Right. What I say, and it will answer your question, Andrew, I'm not going to evade the question, is that each individual family unit needs to make a risk-benefit assessment for what they want to do with the holidays. It will be different for each person and each family unit. If you have in your family vulnerable individuals, the elderly or people who are immunosuppressed, obese, diabetes, heart disease, you have to ask yourself, for this particular holiday season, Do you really want to take the risk of endangering the health and the life of a loved one? Or do you want to say, maybe this time we'll have a much smaller gathering, or even just the core bubble of your own little group that is generally very, very much following public health measures? Or do you want to have people coming in from different parts of the country, waiting in lines at airport, being on a crowded plane? You have to make that individual decision. You mentioned my own family. My daughters, who are adult professional women in different parts of the country, have made a decision. As difficult as it is, I adore them. I'd love to see them for Thanksgiving. They've made a decision that they want to protect their daddy. They don't want to put me in a position. So as difficult it is for them, we're going to forestall a family Thanksgiving. I'm going to sit down with my lovely wife, have a meal, and watch them on Zoom and wish each other a Thanksgiving happiness. Not every family may want to do that. I think each family makes an own risk-benefit assessment.
Let me ask you a separate question, and this is about therapeutics, which is to say, how critical do you think the therapeutics are going to ultimately be in terms of changing the dynamic of this? And which ones do you think are the most likely to be favorable that are in development right now? This is beyond Regeneron that I'm talking about. I'm talking about things that you might be able to get in the future at your local CVS or your Walgreens. We spend a lot of time talking about vaccines. That's why I'm curious if we should be talking more about therapeutics.
No, therapeutics are important. There are two aspects of therapeutics. There are therapeutics for someone who is sick with advanced disease. We have some of them right now that have dramatically diminished the death rate because we know how to treat them better as physicians and healthcare providers and nurses. But we also have things like dexamethasone and remdesivir. For people early on, what we do need are medications that are orally administered that you can give to someone who has symptoms to keep them from requiring hospitalization. That's the thing that we desperately need, and we are making major investments. Obviously, monoclonal antibodies are very important. We were quite successful with monoclonal antibodies with Ebola. We feel that under certain circumstances, monoclonal antibodies will be quite successful for COVID-19. But we've got to go beyond that. We've got to get something that's easily administered, that you could take a pill maybe for 3 or 4 or 5 days, that's a direct antiviral to prevent you from progressing to the point that you would require hospitalization. Right. To me, that's the aspiration for the future.
Doctor, we've been getting lots of questions that have been coming in from those who have joined us. This is a bit of a philosophical question that I'd like to pose to you, which is the Trump administration has been criticized for not following science, oftentimes at least. And yet we also see countries in Europe, some countries in Europe, that have, quote unquote, followed science. And they are having, I don't want to say as terrible of problems, but similarly are trending in the wrong direction. What do you make of that? What do you make of the idea that there are countries that are following the science and maybe countries that aren't, and yet the results may not be totally different?
Well, what it's telling us, Andrew, is that this is a much more complicated situation than people make it out to be. It has a lot to do with following the science, but you are quite correct. If you look at some of the European countries that have, quote, the leadership has followed the science, what you don't factor in is the important impact of COVID fatigue. COVID fatigue permeates what goes on in many of those countries that initially did follow the science and actually got their baseline very, very low. If you look at the curves of what went on in Europe as the European Union, they had a really bad time early on in the spring. They came down to a very low baseline, and they stayed there for a long period of time. Now, being that Europe is in the Northern Hemisphere, as we're getting colder weather, there is a high element of COVID fatigue. I get on the phone with my colleagues in Italy, in the UK. Right. They're telling us the same thing. So it transcends this issue of following the science or not, and has to do with COVID fatigue, which is one point I would like to make, Andrew, is that given the fact that we've been fortunate enough that the science has given us at least 2 and likely more vaccines that are highly effective and safe, we should use that vaccine to say, you know, there is light at the end of the tunnel. I use the metaphor, the cavalry is on the way, which means rather than give up on public health measures, we should say, now that we see the end in sight, now is the time to double down, put aside the COVID fatigue and say, we're going to implement public health measures to the point when the vaccine gets to that point that you mentioned early in discussion, where we have a blanket of protection, then COVID fatigue will go away because we won't necessarily have to be as stringent as we are. You're not going to abandon public health measures completely, but you won't have them as stringent as they are right now.
Doctor, you long talked about the potential for something like COVID-19. I don't want to leave us on a down note, but what's the thing you worry about next?
Next? You know, that's an interesting question, Andrew. People have asked me throughout the years what my worst nightmare was. And I've always say, well, it's a brand new infection that jumps species, that's a respiratory borne, and that has a spectacular capability of going from person to person and has a high degree of morbidity and mortality, either in the general population or among selected groups. Well, here we are. You know, I'm living that thing that I feared the most. Let us get out of this, and hopefully the lessons that we will have learned from this, we will have enough corporate memory that our preparedness will not let something like this happen again. So I worry about the next pandemic because that's what I do. That's what I've devoted my entire professional life to. But right now, let's focus on getting out of this one, and then we'll worry about the corporate memory for the next one.
Dr. Fauci, we appreciate you joining us, for sticking with us. We appreciate everything you're doing for this country. Thank you so much. And thank you, Andrew, for joining us, everybody. We have a lot more coming up. We have another session at 1 p.m. where we'll continue a lot of this conversation with Bill Gates, the CEO of Pfizer, as well as the head of the Vaccine Confidence Project. We'll be back then. Thank you again, Doctor.